Have you ever taken your ADHD medication and instead of feeling focused, you felt like you were vibrating out of your skin? Your heart's racing, maybe your palms are sweating, and your mind just won't stop spiraling? You aren't allergic to your meds, and you aren't imagining it. Your brain is simply caught in a norepinephrine trap. Let's look at the biology of why stimulants can backfire. Now, let me give you a quick caveat. As you guys know, I'm not a prescriber, so what I'm about to share with you is simply based on my observations as a psychologist for the past 20 plus years and working with prescribers for that same amount of time. As with any medication, you must consult with a licensed medical provider to see what works for you. I'm a doctor, but not a physician. You have to consult with a medical provider when it comes to medication. Now, most ADHD meds work by increasing two chemicals, dopamine and norepinephrine. Dopamine is the focus chemical. It makes tasks feel rewarding and helps you stay on track. Norepinephrine is the alertness chemical. It's closely related to adrenaline. In a perfect dose, they balance out. But if your dose is just a little too high, or if your brain is already stressed, that norepinephrine turns into physical arousal. Your brain then interprets that racing and racing heart as danger. And suddenly your ADHD meds have triggered a panic response. This is why the diagnosis matters so much. So if you have anxiety misdiagnosed as ADHD, stimulants are like pouring gasoline on a fire, okay? You're taking a drug that increases alertness in a brain that is already hypervigilant. So that isn't going to work. That's a recipe for disaster. There's a third option, though, which is the comorbidity overlap. Conditions are comorbid when they occur at the same time. So it's a really kind of a dark word, but it just means they co-occur. So nearly half of people with ADHD also have an anxiety disorder. If we don't treat the anxiety hardware first, the ADHD meds will just amplify the anxious noise. If your meds are making you anxious, here's what I want you to look for. So first, I want you to ask your doctor to help you find the Goldilocks dose, right? The just right dose. Your dose might be too high. Stimulants follow an inverted U curve. So too little equals no focus. Too much is jitters and anxiety. You want that sweet spot at the top of the bell curve. Then talk to your doctor about the delivery method of your medication. So immediate release meds can spike your system. Switching to an extended release, like an XR formulation, can provide a smoother sort of climb. Then I also want you to ask your doctor about non-stimulant options. So meds like guanfacine or Strattera work for ADHD, but they work differently. They can actually lower that fight or flight response while still helping you focus. And next, do a caffeine check. Are you drinking coffee with your meds? Because that's a double hit of norepinephrine. Try cutting the caffeine first and see what happens. Don't suffer through the jitters, okay? Your medication should make your life easier, not scarier. But don't play around with these meds and dosages without supervision because that is a dangerous game. Doctors get paid to help you. Let them do their job. So always talk to your prescriber before changing your dose. If you've had success with ADHD versus anxiety, trying to sort that out, tell us what was helpful for you, or if there's a medication that has been really helpful for you, feel free to share that in the comments, and be sure to share this video with someone you think it could help.